Nearly 50% of dementia cases could be prevented. Let that number sit with you for a moment. Not 5%, not 15%, nearly half. That is not a fringe statistic from some alternative health website. That number comes from the Lancet Commission, one of the most respected medical publications on Earth, and it has been quietly updated and expanded over the past several years to include even more modifiable risk factors than researchers originally identified. And yet, when was the last time your doctor sat down with you during a routine appointment and walked you through, point by point, what you could be doing right now, today, to protect your brain from the slow erasure of dementia? The answer for nearly everyone watching this is never. Not once. And there is a reason for that. The system you rely on for your health is not built to prevent dementia. It is built to manage it after it arrives. There is no billing code for a 45-minute conversation about how to protect your hippocampus. There is no pharmaceutical representative visiting your physician's office to promote daily walking, hearing aids, or blood sugar control. The healthcare industry does not profit from you keeping your mind sharp at 85. It profits from the medications, the memory care facilities, the diagnostic imaging, and the long, expensive decline that follows a diagnosis. This is exactly why this channel exists. Subscribe to Dr. Waterling right now and press that like button. We are working toward 1,000 subscribers, and we are building this channel on one principle. The information that protects your life and the lives of the people you love should be free, clear, and given to you without an agenda. Every subscriber moves us closer to that mission. Now let's be clear about what this conversation is and is not. This is not about reversing advanced Alzheimer's disease. If a loved one is already in moderate or severe cognitive decline, that requires neurological care, family planning, and professional support. What we are talking about today is the slow, silent, decades-long process that happens inside the brain long before the first missed name or forgotten appointment. The damage that begins in your 40s and 50s and only becomes visible in your 70s. That window, that long, quiet window, is where nearly 50% of cases can be stopped. And almost no one is telling you how. Here is what is happening inside the brain of a person developing dementia. And this is important because once you understand the mechanism, the interventions stop sounding like vague wellness advice and start sounding like the precise medical strategy they actually are. The brain consumes roughly 20% of your body's total energy, despite weighing only about 1.4 kilograms or 3 pounds. It is the most metabolically demanding organ you have. Every thought, every memory, every word you are processing right now requires a constant, uninterrupted flow of oxygen, glucose, and nutrients delivered through a network of blood vessels so fine that some of them are only 1 cell wide. When that delivery system begins to fail, even slightly, even in ways you cannot feel, brain cells begin to suffer. They do not die immediately. They become inefficient. They lose connections. The branches between neurons called dendrites begin to retract. This is happening, in small ways, in millions of people watching this right now, and they have absolutely no idea. There are 2 major processes that drive this slow erasure. The first is vascular damage. Tiny strokes called microinfarcts occur in the deep tissue of the brain when small vessels become blocked or leaky. Each one kills a microscopic patch of tissue. You will not feel a single one. But over 20 or 30 years, thousands of these silent events accumulate, and the brain begins to develop what neurologists call vascular cognitive impairment. This is now understood to be involved in the majority of dementia cases, often combined with the second process. The second process is protein accumulation. The brain has a remarkable cleaning system called the glymphatic system, which works primarily during deep sleep to flush out metabolic waste, including a protein called beta amyloid. When deep sleep is disrupted, when sleep apnea goes untreated, when alcohol fragments your sleep architecture, this cleaning system runs at reduced capacity. The waste begins to build up. Over decades, it forms the plaques that we associate with Alzheimer's disease. Think of it as a factory that runs every night to take out the trash. If you let the trash sit for 20 years because the cleaning crew can only work half shifts, eventually the factory floor becomes uninhabitable. Now here is what nobody tells you. These 2 processes, vascular damage and protein accumulation, are both heavily influenced by factors that are entirely within your control. Not genetic factors, not bad luck, not inevitable aging, modifiable factors. Things you can change starting today. The Lancet Commission identified 14 modifiable risk factors that together account for approximately 45% of dementia risk. Let me name them because your doctor almost certainly never has. Lower educational attainment in early life. Hearing loss in midlife, high blood pressure, smoking, obesity, depression, physical inactivity, diabetes, excessive alcohol consumption, traumatic brain injury, air pollution exposure, social isolation, untreated vision loss, and elevated LDL cholesterol. 14 factors. And of those 14, at least 10 can be meaningfully addressed by an ordinary person, in an ordinary life, with no expensive equipment and no specialist intervention. But here is where the system fails you. When you walk into a 12-minute appointment, your physician has time to check your blood pressure, glance at your lab work, refill your prescriptions, and send you on your way. There is no time to discuss your hearing. There is no time to ask whether you are socially isolated. There is no time to walk you through the relationship between your nightly sleep architecture and the protein clearance in your brain. So these factors go unaddressed for decades, while pharmaceutical interventions are escalated for blood pressure, cholesterol, and blood sugar in isolation, without anyone connecting the dots back to the brain. Think about this. The current standard of care for early cognitive complaints often follows a predictable pattern. A patient in their late 60s reports occasional forgetfulness. The physician orders basic blood work, perhaps a thyroid panel and a B12 level, and reassures the patient that this is normal aging. 2 years later, the symptoms have progressed. A cognitive screening test is performed in the office. Some decline is noted. The patient is referred to a neurologist who orders imaging. By the time a diagnosis is made, the underlying damage has been accumulating for 15 or 20 years. The medications that exist for Alzheimer's disease at that stage offer, at best, modest symptomatic benefit. They do not reverse damage. They do not restore lost neurons. The window for prevention has already closed. This is not a criticism of individual physicians. Most of them are working within a system that does not reward prevention. It is a criticism of the system itself. And it is the reason you, sitting where you are right now, need to take responsibility for this yourself. Because nobody is coming to do it for you. How old are you? Write it in the comments. I want to see which age group is taking this information seriously, because that will shape every video that comes after this one. Whether you are 45, 55, 65, or 75, the protocols are not too late, but the urgency does change. Now let's get to what actually works. And I want to be specific because vague advice is useless. I am going to walk you through, in detail, the 8 pillars of brain protection that have the strongest evidence behind them, exactly how to implement each one and what to expect. The first pillar is blood pressure control. This is the single most powerful modifiable factor in vascular dementia. The target most cardiologists are now using for cognitive protection is a systolic pressure of 120 or below in adults under 80, and individualized targets for older adults. If your systolic blood pressure, the top number, has been running 140 or higher for years, the small vessels in your brain are taking damage you cannot feel. Check your blood pressure at home, not at the doctor's office where it is artificially elevated by anxiety. Use a validated upper arm cuff, not a wrist device. Take 3 readings in the morning, 1 minute apart while seated quietly, and average them. Do this for 7 consecutive days. If your average is above 130 over 80, this is a conversation to have with your physician. Do not stop or change any medication based on this video, but bring the numbers in. The second pillar is hearing. This one shocks people. Untreated hearing loss in midlife is now considered one of the largest single modifiable risk factors for dementia, accounting for roughly 7% of total risk. The mechanism is twofold. When the brain receives degraded auditory input, it works harder to interpret sound, diverting resources from memory and executive function. And when hearing loss leads to social withdrawal, the cognitive stimulation that protects the brain disappears. If you find yourself asking people to repeat themselves, turning up the television louder than others find comfortable, or avoiding noisy restaurants, get a hearing test. A proper audiogram. And if hearing aids are recommended, wear them, not in the drawer, in your ears. The data on hearing aid use and cognitive protection is now strong enough that this should be considered a medical intervention for brain health, not a cosmetic decision. The third pillar is deep sleep. This is where the glymphatic cleaning system does its work. Adults over 50 need 7 to 8 hours of sleep, with particular emphasis on the deep, slow-wave sleep that occurs in the first half of the night. If you snore loudly, gasp during sleep, or wake unrefreshed despite spending enough hours in bed, you may have undiagnosed sleep apnea. This is enormously common and enormously under-recognized. An overnight sleep study, which can now often be done at home with a small device, can identify this. Treating sleep apnea with a CPAP device has been associated with measurable reductions in cognitive decline. If you have sleep apnea and you are not treating it, you are letting your brain marinate in metabolic waste every single night. To improve deep sleep beyond apnea treatment, the protocol is specific. Stop eating at least 3 hours before bed. Stop drinking alcohol at least 4 hours before bed and ideally eliminate it on weeknights entirely. Keep the bedroom temperature between 18 and 20 degrees Celsius, or about 65 to 68 degrees Fahrenheit. Block all light, including small LEDs, from electronics. And get bright outdoor light exposure within the first hour of waking, ideally 10 to 20 minutes of direct outdoor light on your eyes, not through a window. This single habit recalibrates your circadian rhythm more powerfully than any supplement. The fourth pillar is physical movement, and specifically the kind that elevates your heart rate for sustained periods. The brain responds to aerobic exercise by releasing a molecule called brain-derived neurotrophic factor, often abbreviated BDNF. Think of BDNF as fertilizer for neurons. It promotes the growth of new connections, supports the survival of existing neurons, and is one of the few interventions shown to actually increase the size of the hippocampus, the memory center of the brain, in older adults. The minimum effective dose is 150 minutes per week of moderate intensity aerobic activity. That is just over 20 minutes per day. Brisk walking counts. The intensity benchmark is simple. You should be able to speak in short sentences but not sing. If you can sing comfortably, walk faster. If you cannot speak at all, slow down. Add to this 2 sessions per week of resistance training. Even simple bodyweight exercises like sit to stand from a sturdy chair, wall push-ups, and standing on one leg for balance. Sarcopenia, the age-related loss of muscle mass, is now understood to be linked to cognitive decline, likely through inflammatory and metabolic pathways. The fifth pillar is nutrition, and here I want to be careful because there is enormous noise in this space. The dietary pattern with the strongest evidence for cognitive protection is the MIND diet, which combines elements of Mediterranean and DASH eating. The specifics are these: 6 or more servings per week of leafy green vegetables. Spinach, kale, romaine, arugula. 1 serving is 1 cup raw or half a cup cooked. At least 1 other vegetable per day. Berries at least twice per week, with a particular emphasis on blueberries and strawberries. Nuts 5 or more times per week, about 1/4 cup per serving. Olive oil as the primary cooking fat. Whole grains in 3 or more servings per day. Fish at least once per week, ideally fatty fish like salmon or sardines. Poultry twice per week. Beans more than 3 times per week. And the foods to limit, not eliminate but limit, are red meat to less than 4 servings per week, butter to less than 1 tablespoon per day, cheese to less than once per week, pastries and sweets to less than 5 times per week, and fried or fast food to less than once per week. Studies of adults closely following this pattern have shown approximately a 53% reduction in Alzheimer's risk in those with high adherence. The sixth pillar is blood sugar control. Type 2 diabetes roughly doubles dementia risk. But even prediabetes, the elevated blood sugar state that affects roughly 1 in 3 adults over 50, contributes to cognitive decline through what some researchers now call type 3 diabetes, referring to insulin resistance in the brain itself. Ask your physician for a hemoglobin A1C test. This measures average blood sugar over 3 months. A result above 5.7 indicates prediabetes. A result above 6.5 indicates diabetes. If you are in either range, the dietary pattern above, combined with the movement protocol, can move that number meaningfully within 3 to 6 months. The seventh pillar is social and cognitive engagement. This is not about doing crossword puzzles, which have surprisingly weak evidence for general cognitive protection. This is about genuine human connection and learning new, complex skills. The brain protects itself through what researchers call cognitive reserve, built through challenging mental activity throughout life. Learning a new language, taking up a musical instrument, joining a class on an unfamiliar subject, engaging in regular, meaningful conversation with other people. Social isolation in older adults carries a dementia risk comparable to smoking. If you are living alone and going days without meaningful conversation, this is not a soft, optional concern. This is a medical risk factor. Join something. A community group, a faith community, a walking club, a volunteer organization. The specific activity matters less than the consistency of engagement. The eighth pillar is the elimination or moderation of harmful exposures. Smoking accelerates vascular damage in the brain dramatically. If you smoke and you do nothing else from this video, stopping smoking is the single highest impact action you can take. Alcohol, even in amounts previously considered moderate, is now understood to shrink brain tissue and disrupt sleep architecture. The current evidence suggests that for cognitive protection, less is better and 0 may be best. If you drink, keeping it to fewer than 7 standard drinks per week with at least 3 alcohol-free days is a reasonable starting boundary. Let me tell you about a patient I will call Margaret. She was 64 when she came to see me and she was frightened. Her mother had developed Alzheimer's at 72, and Margaret had started forgetting names at parties and walking into rooms unsure why she had gone there. Her previous physician had run basic blood work, found nothing alarming, and told her this was normal aging. When we worked through her history, we found several things. Her blood pressure was averaging 148/88, which she had been told was borderline. Her hemoglobin A1C was 6.1, pre-diabetic. She had not had a hearing test in 15 years, and her husband confirmed she was missing parts of conversations. She walked her dog for 10 minutes a day, but did nothing more vigorous. She drank 2 glasses of wine most evenings. And she had recently retired and was, in her words, seeing fewer people than ever before. We did not prescribe a new medication. We built a protocol. Daily home blood pressure monitoring with a target conversation scheduled with her primary physician. A hearing test that resulted in mild to moderate hearing loss and hearing aids she wore consistently. A walking program that progressed from 10 minutes to 40 minutes of brisk walking daily over 12 weeks. The Mind dietary pattern. Wine reduced to 2 days per week. And she enrolled in a Spanish language class twice a week, something she had wanted to do for years. 18 months later, her blood pressure averaged 122/76 with her physician's adjustment of one existing medication. Her A1C had dropped to 5.5, no longer pre-diabetic. She had lost 8 kilograms, about 17 pounds, without trying to. And her subjective memory complaints, the forgetting of names and the walking into rooms, had largely resolved. More importantly, on formal cognitive testing, her scores had improved. Not declined, improved. This is not a miracle. This is what happens when a brain that has been operating in a hostile metabolic environment is finally given what it needs. Now, here is your weekly implementation framework, because information without structure does not become habit. In the first week, focus only on measurement. Buy a home blood pressure monitor and take readings as described. Schedule a hearing test if you have any concern. Note your current sleep patterns. Track what you eat for 3 days without changing anything. This baseline is essential. In weeks 2 through 4, build the movement habit. Start with a 15-minute brisk walk every day. Add 5 minutes per week until you reach 30 to 40 minutes. Do this at the same time every day. The consistency matters more than the duration in this early phase. In weeks 5 through 8, restructure your eating using the Mind framework. Add the leafy greens daily. Replace your cooking oil with olive oil. Add berries to breakfast. Reduce red meat and processed foods gradually. Do not attempt perfection. Aim for steady improvement. In weeks 9 through 12, address sleep aggressively. Implement the bedroom temperature, light, and timing protocols. If sleep apnea is suspected, pursue testing. Get morning sunlight every day without exception. In months 4 through 6, layer in social and cognitive engagement. Enroll in a class, join a group, reconnect with people you have drifted from. Begin learning something new that genuinely challenges you. By the end of 6 months, you will have meaningfully reduced your dementia risk, and the changes will be visible on lab work, blood pressure readings, body composition, and how you feel. Now, I must be clear about boundaries. If you are experiencing sudden, dramatic cognitive changes, getting lost in familiar places, profound personality changes, difficulty performing routine tasks you used to do easily, that is not what we are discussing today. That requires immediate evaluation by a physician and likely a neurologist. 3 symptoms in particular demand urgent attention. Sudden severe confusion, one-sided weakness or facial drooping, sudden difficulty speaking or understanding speech. These can indicate stroke and require emergency services immediately. Do not wait. Do not drive yourself. If you are currently taking medications for blood pressure, cholesterol, blood sugar, or any other condition, do not stop or change anything based on this video. The lifestyle interventions discussed here work alongside medical treatment, not instead of it. As your numbers improve, your physician may adjust your dosages. That is the right way to do this. Everything described here supports your body's own function. It does not replace medical evaluation when something needs to be clinically examined. And if you have specific conditions like a history of stroke, traumatic brain injury, or diagnosed mild cognitive impairment, the general framework still applies, but you need individualized guidance from a physician who knows your full history. Here's the truth that the system will not tell you. Your brain at 50, 60, 70, even 80 is far more responsive to intervention than you have been led to believe. The fatalism around dementia, the sense that it simply happens to some people and not others, is not supported by the evidence. Genetics load the gun. Lifestyle pulls the trigger. And nearly half of the time, the trigger is never pulled at all in people who address the modifiable factors. If this video gave you something useful, send it to someone you love. A parent, a spouse, a friend who has started asking the same question twice. You may have just given them back 10 years of clear thinking and independent living that they would otherwise have lost. That is not a small gift. Subscribe to Dr. Waterling if you have not yet. Hit the like button. And tell me in the comments how old you are and which of these 8 pillars you are going to start with this week. I read the comments and the patterns I see there shape the next videos I make. Your mind is the seat of everything you are. Every memory, every relationship, every skill you have spent a lifetime building. It is worth protecting with the same seriousness you would protect your heart. And the protection begins not in a specialist's office, but in the choices you make this week, this month, and this year. The window is open. Step through it.